Good morning. Welcome to Salina Regional's Morning Medical. My name is Mike Maddock from the Marketing Department at Salina Regional Health Center. This morning's Morning Medical, we're going to be discussing some imaging services at Salina Regional Health Center. With me I have Director of Operations, Mr. Terry Hauschel. Terry, thanks for being on the show.
Thanks, Mike. Thanks for having me this morning.
You bet. I know if we talked imaging services, we would be here all day. So we're going to kind of break it down a little bit and maybe talk particularly about the PET-CT program at Salina Regional. Why don't you tell me a little bit about the program?
Okay. We've been performing PET-CT studies for nearing our 14th anniversary here in Salina. I guess I shouldn't say PET-CT, but we were one of the early adopters. We started with standard PET imaging. One of the things that's happened and one of the advantages of being a pioneer is that we could step back and watch innovation and new technologies evolve, and we could actually select those things that had the most positive impact on our patients and outcomes. And we're real pleased now we have a latest generation Biograph PET-CT scanner over at the Outpatient Imaging Center.
What are some things people should consider, when getting a PET?
Well, of course, as with all imaging, quality is of utmost importance. You want to make certain that you have your study on a PET scanner that integrates both PET, which is molecular imaging, and CT, which is anatomical imaging. Okay. Because when the study's done, we want to be able to fold those two exams together so that we can see the molecular makeup and molecular changes with disease process and align those very specifically with anatomical structures for treatment. Along with that quality and that sensitivity, you want to consider radiation exposure. As we all know, radiation is cumulative throughout our lifetime. It doesn't go away like some other things do. It doesn't wear off. Many people having PET-CT studies are also struggling with oncology-related issues or cancer diagnosis. It's important that we save as much radiation as possible to treat that cancer and not utilize that radiation exposure in the diagnosis. Like I mentioned earlier, we've always considered PET-CT as being oncology related. However, one of the real values of PET-CT is the ability to diagnose Alzheimer's disease. And Alzheimer's exactly parallel to all disease processes. The sooner we can identify that and the sooner we can identify the processes associated with that, the better our opportunities for treatment. Early diagnosis can sometimes allow your physician to prescribe medications or some therapies that can slow the progression of Alzheimer's, therefore enhance quality of life well into our senior years.
Thank you very much for being on the show today. We appreciate the update on what's going on. But thank you very much for watching. For more information, please visit srhc.com and like us on Facebook.